California, I am so amazing. I will talk about to the empagliflozin and the progress of kidney disease on type 2 diabetes. Definition: type 2 diabetes conferring aggressive risks of adverse cardiovascular and renal events. Kidney disease develops in the approximately 25 of the patient with the type 2 diabetes is associated with the increasing mortality. Empagliflozin and sodium glucose co-transporter 2 inhibitor reduce risks and the minor adverse cardiovascular events in patients with type 2 diabetes and high-risk cardiovascular events. And continue. Application in medicine. The use is the empagliflozin is associated with a lowering circulating hemoglobin levels in patients with two-type diabetes, including stages 2 and 3 chronic kidney disease, and with the reduction high blood pressure with the increased skin rate.
Hi friends, welcome to my channel for Medicos. If you or anybody in your family is a diabetic patient, then information in this video will be helpful to you. This video will contains information on new group of oral medications SGLT2 inhibitors used for treating type 2 diabetes. Before starting, if you learn something or if you find information provided in this video as helpful, please motivate us by subscribing, liking and sharing this video. So let's start. Sodium glucose cotransporter 2, SGLT2, inhibitors, which are also known as gliflozins, are a new group of oral medications used for treating type 2 diabetes. The drugs work by helping the kidneys to lower blood glucose levels. SGLT2 inhibitors have been approved for use as a treatment for diabetes since 2013. They are taken once a day with or without food. Drugs in this class are: the following drugs belong to the SGLT2 inhibitors, which are available in different trade names. 1. Empagliflozin, 2. Empagliflozin and 3. Empagliflozin. How do SGLT2 inhibitors work? The kidneys work by filtering glucose out of the blood and then reabsorbing glucose back into the blood. The proteins that reabsorb glucose are called sodium glucose transport proteins. SGLT2 inhibitors block these proteins, which means less glucose gets reabsorbed back into the blood and gets passed out of the body via the urine. Hence, SGLT2 inhibitors work by preventing the kidneys from reabsorbing glucose back into the blood. This allows the kidneys to lower blood glucose levels, and the excess glucose in the blood is removed from the body via urine. Who are SGLT2 inhibitors suitable for? SGLT2 inhibitors may be suitable for people with type 2 diabetes that have high blood glucose levels despite being on a medication regimen such as metformin and insulin. SGLT2 inhibitors are not recommended for prescribing to people with kidney disease, as kidney disease prevents the drug from working sufficiently well. What are the benefits of SGLT2 inhibitors? SGLT2 inhibitors help to remove glucose from the blood and therefore help to lower blood glucose levels and thereby decreases risk of complications of diabetes. By removing glucose from the body, SGLT2 inhibitors can also have benefits for weight loss. Side effects of SGLT2 inhibitors: as the drugs cause more glucose to be excreted in the urine, there is a higher chance of getting genital and urinary tract infections. These side effects are more common in women than in men. Taking SGLT2 inhibitors with insulin, sulfonylureas, or glycidides may increase the risk of hypoglycemia. SGLT2 inhibitors can, in rare cases, lead to a dangerous condition called diabetic ketoacidosis. Thank you for watching this video. Please subscribe.
Pros and cons. Maybe it's associated with terms adverse renal events. Empagliflozin was associated with a lower rates on the Empagliflozin on the lower pulse of weight and blood pressures. Uses in medicine. It's necessary to manage to tell a professional on the patient about this, the risks on the info about the necessary measures to the prevent. The here appearance to cause information has to be released on intrinsic risks on the known traumatic amputations, especially in the adult. On the worst case of diabetics ketoacidosis of unusual presentation, on the severe case of the acute renal failure with the use of these antidiabetics.
The EMPA-REG outcome study was a study designed to assess primarily the safety of empagliflozin in patients at high risk of cardiovascular disease. So the study had a goal of showing that empagliflozin was safe and did not increase cardiovascular risk, but at the same time it was designed to look at whether there would be any benefit of giving this drug to patients with cardiovascular disease. Did it reduce mortality and cardiovascular events such as myocardial infarction, stroke, and heart failure? Patient population were patients with type 2 diabetes who had a hemoglobin A1C of greater than 7%, who also had cardiovascular disease, and that was defined as a prior heart attack, triple vessel coronary disease, or single vessel coronary disease with evidence of provocable ischemia, or they had a prior stroke, or they had peripheral vascular disease. They had to have a creatinine clearance, an estimated glomerular filtration rate of greater than 30, and they couldn't have a body mass index of greater than 45. Empagliflozin is a sodium glucose cotransporter inhibitor, and it blocks the uptake of glucose by the proximal tubule in the kidney. So it blocks both glucose and sodium uptake there. So it increases glucose, it causes glycosuria. So the patient passes glucose in their urine, and it's the glucoseuria which the excretion of glucose, which results in glucose lowering and glycemic control. They're quite powerful agents. In fact, they lower blood glucose more than the DPP-4 inhibitors, for example. So the use of these agents is in all patients with type 2 diabetes who have adequate renal function. And so they have quite a wide application. Primary results the primary endpoint was what we call triple MACE, which is a major adverse cardiac events, which included cardiovascular mortality, non-fatal myocardial infarction, and non-fatal stroke. And there was a 14% reduction in this primary endpoint, which was statistically significant. This is the first glucose lowering trial which has shown a definite primary endpoint reduction, statistically significant. The primary endpoint of the triple MACE was driven by a 38% reduction in cardiovascular mortality, and that cardiovascular mortality was one component of all-cause mortality, but all-cause mortality was reduced by 32% with no reduction of non-cardiovascular mortality. Well, the take-home message is that we now have a glucose-lowering agent which in patients who have cardiovascular disease saves lives. In addition to saving lives, it reduces hospitalization with heart failure, both in patients who had a prior history of heart failure, but also in individuals who had no prior history of heart failure. And heart failure is a very common event in patients with diabetes. First of all, 40% of patients with heart failure have diabetes, and up to 20%, particularly in populations of patients over the age of 65, will have some degree of heart failure. And then abnormal cardiac function, particularly diastolic function, is very common. And there are studies suggesting that up to 50% of patients with diabetes have abnormal relaxation of their hearts. Adverse effects of this agent are very few. The most common adverse effect is genital infections with yeast species, glucose around the genitals is often associated with yeast infections. However, this can be minimized by good genital hygiene, but in addition to that, in the EMPA-REG study, there was about a 6% excess of genital infections, but only 1% of patients had to stop the drug because of this. So it was a very low, and no other side effects. So, for example, there was concern about fractures. We did not see an excess of fractures. We did not see an excess of urinary tract infections. We did not see an excess of diabetic ketoacidosis. So a very safe agent with a relatively minor side effect which can be minimized.
In conclusion, type 2 diabetes patient with high risk for the cardiovascular events who received the policy had a significantly lower risk of the microvascular events, also low risk of the progressing to microalbuminuria or doubling of the serum creatinine level and imitation of the renal replacing the therapy on decrease in the placebo group. Thanks.